I am a practicing internal medicine physician for more than 20 years. I'm from Ohio and I trained at Mayo Clinic, came back to Ohio Cleveland Clinic for most of my career, moved to the Triangle in 2016, and so happy to find UNCPN as my home for practicing, seeing patients, and also working as executive medical director, working with over 20 sites in the West Triangle.
I'm a med-peds doc and medical director of a family practice here in Hillsborough, North Carolina. I am a Midwest transplant, so I grew up in Chicago and through my training had a chance to live in Missouri and Michigan, Ohio, and finally University of Minnesota. And so I've been all over. I came here through the National Health Service Corps actually, originally, and I remember people telling me, "You're going to God's country." And I'm like, "What are you talking about?" And then I came here and I'm like, "You're right, it's beautiful, it's absolutely beautiful." And that's how I ended up in North Carolina. And then I joined our practice, which was a private practice at the time, and joined them about 10.5 years ago.
For me, what makes it unique and what I was looking for when I came here was a physician-led organization. What that means to me is that the physician leaders who are making decisions are seeing patients and understand the challenges that we face.
As physicians, I also feel that we have a seat at the table. You know, our voices are heard and they listen. And I think part of the reason why that works so well is they're all practitioners as well. They're all seeing patients, and so they understand our perspective.
The other thing that I think is unique and a real strength here is the culture. Can be difficult to describe, but I would say is collaborative, inclusive, focused on the patient-physician relationship and the wellness of our physicians.
You're working as a team. So, you know, you have your MOAs, your medical office assistants, your clinical staff members, and your provider working together to care for your patient. And I think that's so important. And it's what is emphasized and rewarded for our teammates as well.
Another great benefit of PN is that our compensation model reflects the priority on quality. And I would share that it's attainable. Over 90% of physicians are achieving our quality targets and making that bonus.
Since we're part of a university, we get to learn the most up-to-date information, I feel. For example, there's a program called ECHO, which is a bunch of providers getting together virtually with specialists. And we are doing this as a collaboration, and we're running through cases together for 6 months and learning about topics.
The relationship with UNC Health and the School of Medicine is very helpful because it connects us to educational opportunities and also resources that guide us at different times, especially during COVID. One example of that recently was some assistance that we needed to feel supported in prescribing of antivirals, and reaching out to the pharmacy team, they very quickly set up an Epic chat resource where we would get real-time support.
You know, I always tell patients that we are in the creme de la creme of all the specialists in this area. The very best come here, and we have access to that. And so through UNC Physician Networks and through UNC Health, we have access to those specialists. And it's just easy. We'll call up one of the docs or chat them on the Epic and say, "Hey, I have a question about this patient." And they communicate very well, and we work well together. So I think that's been a big benefit for us.
One of the benefits that I've appreciated with the support that we have is in our population health efforts. We have embedded licensed clinical social worker and nutrition. We have quality coaches and others that really help me practice at top of license and improve our quality outcomes.
When you're thinking about moving to a place, you want to think about, do you want to be there for a long time? And I think there's a lot to offer here. There's so much diversity in what appeals to different people that you will be, I think, challenged, and you will grow, and you will love it, actually.
Our family really enjoys the fact that because so many people are coming to the area from other parts of the country, there are many opportunities to connect with people of different experiences.
The diversity. You know, we have several college campuses here, so you get an influx of people coming through all the time, and lots of entertainment and arts and development in those aspects. So you do have that. You have an immigrant community, we have a migrant community, and we have a refugee community as well, so lots to learn from that as well.
Besides enjoying the climate and being outside year-round, We enjoy the smaller community feel, exploring different restaurants, museums, and parks.
We're close to the mountains and we're close to the ocean. So if you want to go for a weekend and go away with your family, you could. It's not that difficult. It's just centrally located. It's a great location to be close to a lot of different places in such a short distance.
I have 2 children, one now in high school, the other in college, and one of the drivers in our decision to move here were the educational opportunities. And we've had great experiences in public school and later private schools, and now we're enjoying our son spending time at UNC Chapel Hill.
I have 2 children, an 11-year-old and an 8-year-old, and they're thriving here, honestly. One child's involved in baseball, the other one's in dance, so we're always running to different things. We love to be outdoors, and we don't have far to go because there's a lot of trails, and they've just taken some pride in this area.
I am truly grateful to have found such a great fit at UNCPN.